Good morning to all of you. So today we are going to study the second part of ethical and cultural issues. Yesterday we studied in the last class we studied about what is the meaning of ethics, what are the factors which affected ethics. Now in this class we are going to study what are the general principles of ethics and what is the ethics which is to be practiced by the doctors as well as the nurses, and we shall also be studying about the cultural issues in pediatrics. Now these are the general ethical principles. We had already mentioned about these principles in our class on trends. This is just this is a repetition of what we had already learnt in trends, but because this is included in this particular topic in ethics, so I have included it here also. Now the first ethical principles in pediatric is respect the individual's autonomy. Okay. Now what is the meaning of autonomy? Autonomy implies that all are free to take an active and totally independent role in decision making process. Okay. So if a decision has to be taken, then all are free to take active and totally independent role. And if somebody has to take a decision, so that person should be fully informed. He or she should understand the implications of medical conditions, means what will occur if this disease is there, what is the treatment, what is the complications, what can be the outcome of the treatment. And the issue here is vast majority of the children do not have the ability to be truly informed, and they have to rely on others for guiding. So unless and until the child becomes a mature person, this decision has to be taken by the parents. Okay, and to help the parents, the doctors and nurses' responsibility is to ensure that the true informed consent, the way it has to be taken, why are we taking, what are the alternatives, what are the benefits, what are the risks, all those things has to be explained. So then you come for informed consent. Okay, so autonomy here is free to take decisions based on the information what you have, and because children are small, so the parents will be taking the decision and the doctors and nurses will be facilitating in taking decisions by giving the required information. Second is respect of individual's competence. Now what is the meaning of competence here? Competence implies a patient's level of understanding that allows him or her to weigh up the ethical issues posed by the clinical situation, assimilate this and reach a rational decision. Okay. Now what is the word competence here? Competence here means the level of understanding. The level of understanding, based on the level of understanding, the person will be weighing up the ethical issues based on the clinical situation, what ethical issues can come here. So the person has to weigh up. Weigh means he has to know to what extent the clinical situation is causing ethical issues. Then whatever information that person has will be assimilated or brought together, and then our decision is taken. Okay, so competence here is patient's level of understanding, and that level in which he can understand the ethics related to that particular condition. Okay, now the degree of comprehension is often the problem with young children. Okay, the person cannot comprehension means the person cannot understand. Why? Because we are talking about small children. So it is the responsibility of the parents and the medical team to assume the role of competent advocates on their behalf. So what is to be done and how to be done, the doctors and nurses will be there, so they will be giving the information to the parents and parents will be taking the decisions. Okay, and the basic thing to remember here is competence means a level of understanding about the ethical issues caused by this particular problem. Okay, Third is respect beneficence. Okay, what is beneficence? As we already know, it defines the medical principle of do no harm, and this is included in Hippocratic Oath, and that has to be applicable in all the questions. So in medical practice, the sentence of compromise between benefit and harm, especially with regard to interventional procedures and drug therapy, but should always be biased towards benefit. Okay, so whenever the child is facing any disease, so what we need to do, we have to do some treatment. Okay, so when we talk about treatment, the interventional therapy which are available, and most of the procedures, there will be inherent risk adjusted to it. Okay, so whenever you have a risk adjusted to it, the risk should not be more as compared to benefit. What we are talking here is benefit should be more, the negative aspect of the risks has to be less. So that has to be practiced. Okay, should not give any treatment where the risk is too much more, and if we take about of benefit, that is very less. So here is we have to, that should be always biased towards benefit. So hence in practice it may be perfectly acceptable to embark on high risk therapy in a fully informed individual or his or advocate, provided there is a realistic chance of a reasonable benefit. Okay, so whenever we are talking about a high risk treatment, so whenever there is a high risk therapy, the individual or maybe his advocate means if we are talking about children, so children in terms of maybe parents or maybe legal guardians, so they are their advocate, so they have to be fully informed. And this, when you are taking such a high risk, there has to be a realistic chance of a reasonable benefit. Realistic chance means studies have proved that if you do this particular treatment, this is what we get it. For example, in the last class I was talking about gene therapy for sickle cell disease. Okay, sorry, bone marrow transplantation for the sickle cell disease. So bone marrow transplantation is very costly. Okay, it is quite costly, but there is a reasonable benefit. And what is a reasonable benefit? Studies have proved that those who have taken or those who have undergone bone marrow transplantation, they are now free of sickling. They are now free of sickling. So that is reasonable benefit. Okay, so that is what it is written. There has to be a realistic chance of a reasonable benefit. Okay. Next is respect for truth. There is never a case for willfully lying to the patient. Don't lie to the patient. Many a times what we do is, suppose if we are going to give injection, the child will be usually very stressed by seeing that syringe and needle and all those things. And what is usually said to the child, दर्द नहीं देगा, कुछ नहीं होगा. Okay, so and the child, suppose if the child believes on you, the child will not be expecting that the pain is there, and the child, as soon as he feels pain, he will struggle, and naturally there will be more consequences to the child. So never lie to the child. Similarly, there is rarely any justification in withholding or omitting information from the patient. So there is no sense in hiding anything from the parents. Okay, suppose if some diagnosis is there, if the child is old enough to understand, the parents may not be wanting, suppose if it is a case of leukemia, the parents may not be wanting that the child knows that is a case of leukemia, but the parents have to be told. The parents let the parents decide. But here respect for the truth is, we should never lie to the parents. And when we are talking about sensitive issues, we give the decision to the parents whether they want the child to know about the truth or not. Okay, so this is, we have to inform what is true about the condition. Next is respect of patient confidentiality. All patients have a right to confidentiality. Okay, whatever is a treatment, diagnosis or whatever it is, So it is a patient's choice whether he or she wants the disease which is suffering to be known by others. For example, especially in cases of stigma, okay, many a times, even COVID times also, even though it is a worldwide disease, so there there are some patients where they told अरे किसी को बताना नहीं कि मुझको कोविड हुआ था. Okay, so this is now it is their choice. It is a patient's choice whether he wants others to know that is a case of COVID or whatever disease the child may be having. So disclosure of confidential information without consent may be justified in situations where failure to report may lead to greater disadvantage to the patient, for example physical abuse. But even if the patient may not be willing, this in some cases, for example, here the example is physical abuse. Suppose if you see that there are black marks on the child, okay, and because you have a very good trusting relationship with the child, so the child will tell ki ye aisa somebody has beaten, and because the child is very fearful, he will be telling bhai batana nahi, something like this. Okay, but if physical abuse is not reported, then the child may suffer it again. So all cases of abuse have to be reported, even though the child may be telling that this, please do not report it, otherwise I will suffer more. But the issue here is, if you don't report it, the problems are likely to rise again, okay, rise further. It may start with physical abuse, then other abuses like sexual abuse may come into it, chemical abuse may come into it. So this breach means telling without the consent of patient's confidentiality is done, where if you don't tell it, if the risks are more, then even without the taking consent you have to tell it. Okay, then is avoidance of paternalism and bias. Okay, practitioners should strive to remain truly objective and avoid all personal, racial, cultural, religious and other bias while counseling and treating children. So this we have to keep away, even though we are taking care of, we are talking about children. Even if it is any patient, what we have to do is, we have to keep our own personal, racial, cultural, religious, all type of bias. We should not have anything in our mind that this particular group of people are not so good, they are always liars, they will run away from here. So so naturally whatever things we are in our mind will depend on whatever experiences we have, but whatever it is, we should not keep those things in mind when we are counseling and treating children. Okay, personal prejudice and preconceived ideas must never influence the provision or withholding, whether you are giving treatment, whether you are withholding treatment. Don't have anything preconceived ideas in the mind. Okay, regardless of whether they are disadvantaged or have a pre-existing disability or otherwise, they may be a minority group, or they already have a disability which is existing, or whatever is the condition. Don't allow your own personal feeling to come in maybe given treatment or withdrawing treatment. Okay, the wishes of the parents and guardians must be respected, again regardless of personal bias. So whether suppose if you maybe giving chemotherapy to the child, your own experience may be telling that if you give chemotherapy, the child may not live longer than 1 month, so why to give it? So this may be your own personal bias. But if the parents and guardians are telling that even we know that the child is very sick, so we want the child to live as long as he can, so we want the treatment to be continued, so it is your personal bias that you are not interested to continue the treatment, but you have to respect the wishes of the parents and guardians. There is avoidance of all conflicts of interest. The patient always should come first, and before any vested interest or any third party, including physicians, parents, guardians, extended for the family, the patient comes first. Others' interest is always behind. The interest of the patient has to be respected at all costs. Now, respect the limitations of medical care. So this has to be one thing has to be kept in mind, that we don't have total care for all diseases, there are limited care. For example, if we are talking about a chromosomal disorder, maybe a case of Down syndrome. Down syndrome is very, as compared to other chromosomal disorders, Down syndrome is quite common, but there is not much which you can do it for the child. Okay, so medical care. So in that respect, we have some limitations. So medical care should strive to support the patient and should be tailored to the needs of the individual, including any complications or disabilities. So whenever we are planning care, it has to be a patient to patient basis, depending on the particular disease which the child is suffering. For example, bed number 1 may be a case of Down syndrome, second patient may be a case of typhoid. So whatever care you are planning for Down syndrome will not be applicable in the case of typhoid. So it has to be on a one-to basis, and you tailor the need according to that, including any complications or disabilities. So it is ethically appropriate to appreciate realistic goals which the medical care can achieve. So appreciate realistic goal. For example, if you are talking about mental retardation, okay, in cases, suppose if it is severe mental retardation. So in severe mental retardation, set realistic goal. For example, the taking the spoon of food in their mouth and eat it without spilling it. Now this is a realistic goal. Okay, what I expect here now, that the child should be able to pick up a spoonful of whatever he wants to eat, take it to the mouth and eat it without spilling it. Now this is a realistic goal. And what is not realistic? I am expecting that not a single drop should fall. The child will be able to manage everything. The child should not spit at all, will sit comfortably. So this is all not realistic goal. So realistic goals are those goals which can be achieved, because in chronic disorders there is a limitation where we cannot go beyond it. Okay, so set realistic goals which the medical care can achieve, and wrong to aim about exaggerated or impossible expectation. A child who is having severe mental retardation, I cannot have I cannot set an unrealistic goal that he will be able to drive his vehicle, go to and get the go to the market, get the things, come back. So these are all exaggerated or impossible, because the medical care is not able to increase his mental capacity. Okay, so it is equally unacceptable to treat at all costs and to play God. We cannot play God. What is the meaning of playing God? That nothing is impossible, everything is treatable. Your child will become 100% all right, nothing to worry. So this is all playing God, even though we may know that this is a case of Down syndrome, or this is a case of some other chromosomal disorders for which you do not have any treatment. So respect the limitations of medical care. So when you know that we cannot go beyond this point, set small realistic goals and try to achieve those goals. Do not set the unrealistic goal or exaggerated goals. The issue is, say you set the goals and go away, but it is the parents who suffer the most, because parents will be stressed to a great extent, that they will be thinking the goal was to reach to this level, but my child is unable. So this creates more stress for the parents. So never do that. So respect the limitations of medical care. Now, what are the principles of medical ethics? The physician should be dedicated in providing competent medical care with compassion and respect for human dignity and rights, based on all the principles which you have studied. So these are the principles of medical ethics, that the physician should be dedicated in providing competent medical care, and this has to be given with compassion, and at the same time giving respect for dignity and rights, human dignity and rights. Shall uphold the standards of profession, be honest and strive to report physician deficient in character or competence, or engaging in fraud and deception to appropriate entities. Okay. Suppose if the physician is has to be honest, and if somebody is not doing the work properly, maybe engaging in some unlawful practices, it has to be reported. It has to be reported to the appropriate authorities. Okay. shall respect the law and also recognize the responsibility to seek changes in those requirements which are contrary to the best interest of the patient. Okay. The law has to be respected, and if some changes are to be made so that the patient's condition can improve, so that changes have to be sought. Okay. If any changes are required because of which the patient's conditions can improve, so those laws have to be those changes has to be done by the physician. Shall respect the rights of the patients, colleagues and other health professionals, and shall safeguard patients' confidences and privacy. Okay. The physician should respect the rights of the patient, should respect the rights of the colleagues and other health professionals, because suppose see for example, if a child is admitted, one physician will not be taking care of the child or one pediatrician will not be taking care. It is a team. So, the condition of the child has to be shared with the colleagues, okay, or the nurses who are working there. So, it is a right to know the condition of the child. So, that has to be respected by the physician and other healthcare professional, and at the same time safeguard patient confidences and privacy. Shall continue to study, apply and advance scientific knowledge and maintain a commitment to medical education. So, the physician at all time has to continue to study, because research is going on everywhere. Most of the topic research is going on. So, whenever a particular case is there, the physician should research on what is going on and apply and advance scientific knowledge and maintain the commitment to medical education. Okay. For example, this new normal situation of COVID, you must have seen there are many videos released from time to time by WHO, by other relevant health authorities in different countries, where the norms keep on changing. Norms keep on changing because of whatever research studies are or based on findings of different research studies. So, the physician cannot stick to what he has learned, but the physician has to continue to study, so that whatever latest scientific advancements are there, so they can be applied in the proper manner. A physician shall recognize a responsibility to participate in activities contributing to the improvement of community and betterment of public health. So, a physician is responsible to participate in all activities contributing to improvement of the community. Okay. For example, if the health checkup is done has to be done for children, maybe for under 5. So, as a physician, the person has to participate. Why? Because this will lead to improvement in the community and betterment of public health. A physician, while caring for the patient, shall regard responsibility to patient as paramount. Paramount is very important. Okay. So, the physician has to have responsibility, a very important responsibility towards the patient. Okay. Then a physician shall support access to medical care for all people. The physician cannot, the physician cannot be biased, that he will give treatment to some people, will not give treatment to a particular group of people, that he cannot do, but he shall support access to medical care for all type of people. Now, we are talking about nurses, the ethical issues related to working with children and their family. Pediatric nurses must examine their own values so that they can provide nursing care in ethical manner. Okay. She should introspect herself, examine their own value, and at the same time should not allow those values if it is negative values, should not hinder in the nursing care, but if they are positive values, this should guide her to provide nursing care in an ethical manner. Each situation must be evaluated individually. So, that is very important, because each family is different, each case is different. So, this has to be evaluated on a one-to-one basis. Okay. And the nurse relationship with the child and the family is very important. Every day, the pediatric nurse encounters families from a wide variety of religious, cultural, ethnic background, and is critical to treat each family with respect. Okay. You must have seen patients who are even in Indian setup. Somebody may be from Punjab, somebody may be from South, somebody may be from Chhattisgarh. So, different type of people with different diseases, they are coming, belonging to different religions. So, a pediatric nurse will have all types of religions, all types of age group, different type of people who are coming from different types of the background, religious, cultural, ethnic background. It is critical to treat each family with respect. She cannot distinguish that this particular group is good, this particular group is always bad. No. Then as family centered care focuses on the needs of the child and the family together and involves ethical treatment of the child. Okay. So, we talked about family centered care when we were studying about trends and issues. We have already studied. So, they focus on needs of the child and the family together, and the child has to be treated ethically. A nurse is accountable and uses sound reasoning to resolve ethical challenges. Okay. So, if some ethical challenges, see, we are accountable for all our actions, whatever responsibility is given to us, we have to complete those things, and we have to have a sound reasoning to resolve the ethical challenges. If ethical challenges are there, we have to have a sound reasoning how to resolve it. And ethics includes the basic principles of autonomy, and we have studied all these ethical principles. All this has to be kept in mind. So, the nurse must understand these principles in order to analyze and respond to ethical dilemmas. So, whether this is right, whether this is not right, so that is all ethical dilemmas. So, these principles have to be kept in mind to manage those issues. Advance in science and technology have led to increased number of ethical dilemmas in healthcare. Okay. So, science and technology, we have different care which is being changed every time, okay, because there is advance in the science of technology. So, there are ethical dilemmas. Ethical dilemmas are there because of the advance in the science and technology, and many institutions, they have their own institutional ethics committee who provide case by case review resolution of ethical dilemmas, but also review and resolution of ethical dilemmas, but also review this is a repetition, but also review existing institution policies and provide education to staff, physicians, children and families on ethical issues. So, what is the responsibility of the ethical committee? They have the resolution of case by case resolution and of the ethical dilemmas, and at the same time they review what is the existing institutional policy. Based on the existing institutional policy, the treatment is done, and at the same time the staff, physician, families are all educated on ethical issues by the institutional ethical committee. The nurse must understand these principles in order to analyze and respond to ethical dilemmas. Okay. There are these principles have to be kept in mind, and whenever we are coming across ethical dilemmas. What is ethical dilemmas? Whether this is right or not right. So, this plus minus things are always in front. So, that is called as ethical dilemmas. So, autonomy refers to the freedom to choose and self-determination regarding to making healthcare decision, and the parents have the autonomy to make healthcare decision for the child. We have already studied this earlier. So, what is autonomy? Taking your own decisions. Okay. So, it refers to freedom to choose and self-determination in making of healthcare choices. What is to be done will be decided by the parents. In situation, older children have the autonomy to give opinion for care. But if it is an old child, the child can be involved. The child can be involved because we are talking about taking care of his health. So, the child has to be involved if it is older. So, that if we involve him, then the planning nursing care will be much better. In special situation, adolescents are granted autonomy to consent to healthcare procedures without the parents' knowledge. Suppose if you have some setup situation which is a very special case, then you may even the child can give his or her consent when the families are not present. Okay. So, beneficence refers to actions that will benefit others. In pediatric care, this means action of kindness that will benefit the child rather than harming him. So, all pediatric care practices are scheduled in such a way that they should benefit the parents, but not give harm. So, non-maleficence means avoid causing harm intentionally or unintentionally. So, that is non-maleficence. Justice is acting fairly treatment decisions will not be based on such gender, religion, socioeconomic status or ethnic group. Okay. So, these whenever we are giving treatment, we have to give by doing justice, and should not be categorized based on age, gender, religion, socioeconomic status or ethnic groups. Okay. So, awareness of professional ethics and its contributing factors could help the nurses and healthcare professionals to provide better services for patients, and at the same time such understanding would be valuable for ethical administrators for effective planning and judgment. Okay. So, as pediatric nurses, it is very important to be aware of the professional ethics. We should also know what are the contributing factors, so that we can control it, and at the same time this would facilitate provision of a better services for the patients, and at the same time this administration this aspect will be useful for educational administrators, so that they can do a effective planning and management. So, that was all from my side. In the next class, we shall be studying about cultural aspects. Thank you for a patient listening.